Hello, my friends. Hello. See, any of my friends is in, yeah. Very good morning. Maybe it's still early, yeah. Yeah. Good morning. Let's share the page to our friends, yeah. Any friends who's in, say hi to me, yeah. Hello, I can see my friends are in. Some of my friends, yeah, very good morning to all of you. Yeah, say hi to me. Yes. Good morning, Li Jin. Good morning. Li Jin, can you hear me well? Yeah, good morning, Li Jin. Thanks. Good morning, Doris. Yeah, can you hear me well? Yeah, just to confirm. Yeah, thanks, Li Jin and Doris. It's a happy Saturday. So last night we celebrated our 𝗔𝗂𝗏𝗧, the last day of Chinese New Year. Yeah. So yeah, thank you, Li Jin. So yesterday night we were celebrating the 𝗔𝗂𝗏𝗧 and we lao sang one more time. So it should be said it's the last day of our Chinese New Year yesterday. So today is a new day. We start off again. Yeah. Yeah, thank you, Doris. Yeah. So how do we feel, for this Chinese New Year is a different thing. So I have been talking to my my guests recently. So when we come to the topic, how is the MCO and how is everybody's feeling? Sometimes when we talk, the feeling just came, just come sort of feeling sad, sometimes. Why are we feeling sad? Everybody will have different reason. Yeah, of course. Yeah. Thank you, MK. Thank you, MK. Yeah, thank you, MK. Yes, thank you. So some may have a different kind of feelings. Yes, because every family they have their own sort of what's happening. For me, let's say for Auntie Boleh, yeah, we already retired. So though sometimes we have part-time, but we used to have a lot of activities. I'm a member of NGO, 𝗂𝗶𝗵𝗀𝗧 We used to have a lot of activities where we can actually arrange our time very well. But the suddenly lockdown sort of, partially or whatever, for this 1 year, we have not have anything, but we only have things in the Zoom. So this kind of thing, suddenly we can't adjust ourselves to it. At one time, at the very beginning, I'm also feeling very down. So today, actually, we are very blessed. I am, yeah, to have Dr. Siva is a psychiatrist, and he also associate professor and deputy head of Monash Clinical School of Johor Bahru. So because he's a very busy doctor, yes, I know, but anyhow, he gave me the time today. He's able to come to me. I'm willing to come to Auntie Boleh. Yeah, thank you, Li Hua, Margaret. Thank you. So it's good to talk about our feelings. Sometimes the feeling, whether when we have our feeling, this kind of whatever feeling, are we able to accept it? You see, yeah. Yeah, thank you, Li Jin. With the lockdown for a whole year and we survived. Yes, we survived. Yes, but our feeling is really up and down for me lah. Okay, it's really up and down. So we accept our feeling. Is it? How is it? I'm not sure. So it's good that we have Dr. Siva here with us. So at least to tell us how to deal our feelings. Yeah, how is MCO affecting us emotionally, our feelings? So I'm very glad today that I'm able to get Dr. Siva to be with me. Yeah, so now we don't waste time. We get Dr. Siva to be with me here.
Hi, good morning.
Thank you, Dr. Siva, for being. I'm so happy and so fortunate to have you with me. Yeah, to talk about our feelings. Yeah, Doctor, would you like to say anything to our viewers here? Yeah.
Thanks, Auntie Boleh. A very good morning, everyone. And I think I have to congratulate everyone for I saw Legion's message, for being able to get through that 1 year of lockdown. I think that's a great feat,
Yeah.
Great human feat. And thanks for having me on the show, Auntie Boleh. I think it's my pleasure. It's my honor to be on the show.
Yeah, yeah, because we have been recently talking to friends, even though my last Auntie Bole, the few one pass, when we talk about feelings, everybody have a very mixed feeling, different kind of feeling, that's how sometimes we do it have to accept our feeling, and how are we going to deal with our feeling? There is something that we have to deal. So okay, let's go to the point, Dr. Siva, let's talk about, you see when during this pandemic for about just a year already, going to be a year by next week or whatever. So how and why do the MCO can be affecting so many people? Would you like to tell us more on this issue? Yeah.
Thanks, Auntie. Yep. I think that's a very good question, because we most probably have never been going through anything like this. This is a first time experience for everyone. I think it starts off with the fundamental idea that humans need to survive in a group socially. They need to be connected socially. So I think it starts from there. So I think the to your question, if I have a one-word answer, I will say social isolation. I will say social isolation. Now, many of us, don't understand what social isolation is. But social isolation has actually brought about a lot of changes, and I'm just quoting some facts that we've got from research. Social isolation is actually twice as more harmful to the physical and the mental health compared to smoking 15 cigarettes a day. It's that bad. Social isolation can actually increase your chance of stroke or having a heart disease by 30%.
Oh.
Yeah, I didn't know it when I actually looked at it some time back when I needed to speak on this week. Yeah. Social isolation can also cause premature death.
Oh.
And also social isolation can increase your chances of dementia by 40%. So, yeah. So social isolation is a huge thing, But then, Auntie Bole, you ask me, so what has social isolation got to do with health, isn't it? What's the link? We don't know it, we don't realize it, and we've never looked at it. But there's a very close link between being isolated and changes in our body, especially in the cells in our body. Now, maybe explaining it very simple. In the body, we've got something called the white cell, which helps with our to fight germs, to fight virus, and all those things. Now, in social isolation, research and investigators have found that white cell reduces, and it makes the body more prone for infection, more prone for other diseases. So there is a very, very close link.
So that's why we didn't know it can be extend to so many of these side effects.
Yes. And I think the biggest thing that actually has happened is like what you have, everyone has told, is it's changed the structure of our life, isn't it? Everyone's life has changed. We are not going out, just like what you were saying, Auntie Bole. You used to have so many activities, and now, last year the number of activities has been cut down. We are learning how to do it. None. Yeah, exactly. We are trying to learn to do it online. But as much as you can do it online, there's nothing to beat face to face, isn't it? And when all these changes take place, what has happened is also we have all lost something in our life, and that's a huge word that we never think about. A word called resilience or resilient.
Resilience.
Yeah, resilience. What is resilience? Resilience is human strength to overcome problem, to feel I am worthy, to feel I have a purpose in life, to feel valued. So I build factors or resilient factors, and most of our resilient factors are going out, meeting friends, having activities. And what happened was, when it shut down very fast. MCO. There was not much of a warning, maybe a few days warning that we're going to shut down. We were not ready for it. We were not ready for this change. And when it changed people's life, People couldn't go out. People couldn't do the things they were talking. I used to meet an old uncle who comes to my clinic, and he came all the way from Batu Pahat actually. And when he used to be quite a sportsman. He used to go out, play badminton, go for jogging, and all, go to friends' house, play mahjong. But when it shut down, he couldn't do anything. He couldn't go for his jogging, scared. He couldn't badminton, all the courts is closed. Friend's house, definitely cannot go and play mahjong. Then he started sitting down and thinking, and then he started having anxiety, started having panic attacks. So a lot of these things actually come up. So we lose, or we have lost, our resilient strength. That's a big change that's happened, Auntie Boleh.
Yeah, sometimes it's very true, doctor. But then just now you said resilient, this kind of thing, and the social isolation. I really don't understand, because you say it can increase the stroke. And recently, I have I just came across my friend about my age. She just got the stroke just before Chinese New Year. This thing just struck my mind. And then you say premature of the what of death, okay, the dementia. That's why this kind of thing, actually for us is quite difficult to understand all these things. Why is it happening? It's good that you tell us that this thing will happen. So is it something to do that we have to accept this kind of feelings, that will be happening to us? How are we, to deal with this kind of thing? Yeah.
Yeah, true. I mean, most probably why all these things are happening, Auntie, is because lifestyle has changed. Lifestyle has changed. So let's say someone who gets stroke or who premature death, it may be the fact because we have stopped doing the things we do, like exercises, going out, moving, just by going out and meeting people or going for a face-to-face laughter yoga class, you increase so much of chemicals in your brain, which helps you. It actually helps you. And by not doing, you're cutting off a bit of your life, so that's what we have been doing. Dementia, sometimes when we go out every day, we use our brain function. So I would expect that if you use it less, the dementia that is there will actually get faster, the progress will get faster. Yeah. So I'm going to, I'm most probably, I think we'll leave it to the last maybe 10 minutes, Auntie Boleh, if it's okay, to talk about what can everyone do to help, to stop this, to avoid this.
Yeah. So okay, let's see. Okay, my viewers, you see, if you do have any question which you think that you want to ask Dr. Siva, maybe you can just write down in the comments, you see. So some of my friends here, okay, like Li Jin, she did say that, thank you, Dr. Siva, for highlighting social isolation and the power of resilience and friends. Actually, what Dr. Siva, you just say that, friends, having friends, at least now we can talk to. Sometimes when we talk to friends, we may cry, cry and just pour out. We should acknowledge our feelings, this kind of thing, And so family, like Li Jin said, also family, they play mahjong themselves, lifestyle. Definitely, to like Doris we say, no man is an island. Thanks, Dr. Siva, for this gentle reminder. I see, because like we Auntie, we used to dance, we have a lot of dancing class, But all this stop, So the other day we were trying to recall, hey, how come I cannot recall all the steps? Previously we can just one time we dance 20 dances. We can remember, right? You see, the aunties are so good in the dancing class. They can remember. So as what you say, so we lessen down the frequency of doing all these things. So all these things will slow down. Actually, it's actually quite something that happening. Like, okay, you see, Dr. Siva, okay, you see this kind of thing happen. That means quite sort of a negative things, like that it happened to our emotion and this kind of thing. But at times, you see, last time when at the beginning, quite the maybe middle of last year or what, things happening, like, you see people, they even come to the stage of they commit suicide. The suicide situation during that time has sort of increased a little bit. So why or how is it this kind of thing happen during this pandemic. Yeah.
Yeah, I think Auntie Boleh, you're correct. Though we don't see it on the first page or we don't see it on the headlines about suicide, there has been an increase in suicide. I'm just quoting from our local statistics. I think it's from the Consumer Association from Penang, which stated that from police statistics, okay, but this may be a bit old, from March till October of 2020, okay, March till October of 2020, there were a recorded 266 suicides, okay, which is over just a couple of months, So, and that's quite big. That's actually quite big. At that point in time, 266. At that point of time, if you actually compare people who ended their life by suicide compared to people who actually lost their life through COVID-19, the number of suicide was equivalent to almost 94% of people who actually lost their life from COVID, So it's almost equivalent, So showing that, yes, there is an impact, there is an impact. So I think it's right and it's correct for you to actually ask the question, why is it that people take their life? Maybe I like to relate a real life personal story, but I mean, without sort of revealing names. This is also a patient whom I saw at my hospital or my clinic. So she was referred to me, and she was a first-time mother also, and living with her husband. And due to the pandemic, she just delivered. Due to the pandemic, her in-laws couldn't come. So her mother couldn't come. Her mother-in-law also couldn't come to help her. So she was left alone with her child. And her husband was working. And the husband couldn't help her much because he was away working most of the time. So, she had a lot of problem. One is she couldn't go out. She couldn't see friends. She couldn't go to talk to her friends and everything. She was under leave, And she had a child at home who was small and no experience,
Yes,
So,
yes, yeah.
you know how difficult that can be. Most people, in Malaysia, they get in-laws to come in. So she had lots of stress, She had lots of stress and she was admitted to the hospital. So she had lots of anxiety, And when we talked to her, she basically said that, she just couldn't think. She just couldn't think because she had too much of anxiety. The main thing is she didn't know what to do. Because not that she was a weak person, in the past, whenever she didn't know what to do, she will go and meet a friend, get a friend's advice, go and talk to the friend, Maybe if she's so stressed up, go out for a walk, go out for just jalan-jalan at the shopping center. Now you cannot do all that, The coping mechanisms were not there.
Coping mechanism.
Yeah, all of us have got coping mechanisms. When I am stressed, I watch movies, I listen to music, I'm a avid collector of the old records, vinyl records. So I listen to my records, and it helps me relax. So different people have got different coping mechanisms. What happens is this poor lady didn't have. So we actually put her on medication. We talked to the husband. We sent her back home. Sadly, she didn't come back to see us. She defaulted her treatment. And when she came back, it was only after her suicide attempt. She actually strangulated herself. She was brought in almost pulseless. The hospital sent her straight to GH. She was in ICU for a few days and she passed away. So it's very sad, very sad. Young, first-time mother, small baby, So and I'm sure there are multiple similar stories. Why? Because we have actually lost our coping mechanisms, People who were very strong, suddenly become weak because they couldn't do things that help them alleviate or help them sort of settle their stress and their thoughts, So coping mechanisms are very good. Like Legion has put there, my coping mechanism is laughter and silence. Yeah, you know, yeah.
Yeah, yeah.
Now you're happy. You're happy. You must be thankful that your coping mechanism is something that you can do at home. A lot of elderly people, their coping mechanisms is going and meeting friends at a kopitiam,
Mm,
sitting down, talking. You cannot do that. You
yeah.
cannot. So that's where when your coping mechanism breaks down, you don't know what to do. Stress comes in. And then some people take the wrong decisions in life.
Yeah, thanks, Dr. Siva, for pointing out. You see, yeah, coping mechanism. Sometimes, yeah, sometimes there are people who knows also. Well, I shouldn't have what. I should maybe call up friends. I shouldn't be. When we are so down, we keep going down and down and down. We cannot go to the brighter side. We keep going to the negative side. So sometimes the adjustment of it, to cope. It's not say everybody is strong as what you say, Dr. Siva. You see,
Yeah.
some may not be strong enough, and that's how they take the choice to end their life. But for those who trying, we are trying. For me, I'm also trying. Though no suicidal thought. At times, we are so down, right? Yeah, we can meet friends. But for that moment, we are okay. But how about the rest of the time? We cannot be calling friends whole day through, How
Yes.
to, sort of to adjust our feet, that's why we see, Lijin say it's a friend, yeah, we can laugh. But at least
Yeah.
there's something, but to people who don't know how to adjust themselves also is another problem, right? So this one we will talk about. Okay, maybe my dear friends, if you all have any question, my viewers, come take a very good chance here. Dr. Siva is here to maybe to help to answer some of our question. Okay, so okay, Dr. Siva, you're saying about coping mechanism. These are the things that we Auntie outside, because Auntie actually nowadays we have a lot of activities on, kopitiam lah, high tea lah, dancing class lah, actually this is a very basic thing that we're meeting up friends. Because we are not working, our mind actually, it's not working that well already. By meeting friends, at least it slow down whatever process. Also sometimes to share our feelings sometimes.
Right.
Okay, so Dr. Siva, so let's talk about what words can you give to us, as an auntie or the seniors, especially, how and you can offer to us, because this thing happened, it affecting us so much. What words can you give to us? How are we going to deal with it? Yeah.
Yeah. Thanks. I think that's something to look at. I think one of those answers, Auntie Bole, is something that you have actually mentioned, the word change, to change with the times. The thing is, we, especially in Malaysia, we don't like to change. I think that's human behavior. We really don't like to change. We like the way we do things, We like to go out to the kopitiams. We like to talk with friends. I mean, we are always a touching community. We like to shake hands, and then we like to go and eat outside, have time with friends. But when we are forced to change, some of us find it very difficult. The thing is, all this COVID came in too sudden. If it had come in very gradually, maybe many of us would have changed or learned how to change. So the fear now is what to do, because the question is, many people ask, so when will this COVID go away? I don't know, actually. It's good that we are starting to get our vaccination. That's good. But remember, everyone, that just getting vaccination is not going to solve all your problems, Even after getting your vaccination, it takes at least a couple of weeks to months to be fully strong or immunized 100%, to build that immunity. So it's not sudden. I quote the DG even says, that traveling interstate is not going to happen unless about 70% of the country is actually immunized, especially traveling from red zones and all. So what can we do? Yeah, what can we do? I think number one is look at structure in life. That is very important, Many of us have got structure in life. What I mean by structure in life is getting up in the morning, doing exercise in the morning, meeting friends, doing things, some timetable or structure in life. Many of our youngsters nowadays don't have structure, which we always keep telling them, hey, please put in some structure, What happened to most of us is after the pandemic, many of us lost structure, because we couldn't go out, we couldn't see this thing. So Many people just slept, got up late, sit at home, look at each other's face, don't know what to do, watch TV 24 hours, So I'm saying put a stop to all that. If you have not done it, do it now. Go back to your structure. That means don't change the way you did things previously. The only difference is you cannot go outside and do things together. But now we are doing things online. Many things are online. So get up the same time. If you cannot go out and do exercise, but you can, take a walk around, do it in the house. Keep that structure. I think that structure of life is so very, very important. Number one. Number two, communicate. Okay, communicate. A lot of people stopped communicating. Whenever the lockdown happened, I know some people who just kept to themselves. They never reached, because they couldn't talk.
Yeah, that's a problem. Yeah.
That's a problem. Yeah. But now we've got so many ways of communicating. Well, to a certain extent, we can actually go out. We can meet people. A small group.
Yeah.
We can talk to each other like what we are doing now. This is communicating. Actually, this is communicating. I agree. It is not going to be as close as face to face, which is so much better. Because that's the interaction that we get. The touch, and this is a bit artificial. But as far as we can, that's what we should do. We should keep the communication. Talk to friends, talk to people, keep communication sessions. That's number two. Number three, build your resilience factors. Build your resilience factors or your coping mechanism. You may not have the previous coping mechanisms. Like, for example, if your coping is, some people I know, when they're stressed, they go out and catch a movie, watch a movie, then they're very relaxed. But now you cannot go out to the theater because all the theaters are closed. So how are you going to do it? Modify that. Many things are on TV now. You have Amazon TV, you have so many movies on TV, many other things. So you have to start building new coping mechanisms, because you don't know how long this lockdown is going to be there for. I know we've gone through a year, so that's why when I asked Auntie Boleh, I said, is this a bit too too delayed, for me to talk on this? But then again, we don't know when and how long it's going to be. So get yourself ready. Get yourself ready, going out and building new coping mechanism. Oh, there's an interesting one by Jade who says, very curious why Japan is reported to have high suicide cases compared to other countries, living in better environment in terms of economic and education. That's most probably also a different way of looking at it. Yes, I would agree with Jade that Japan has got one of the highest suicide rates. But you must understand that because they have very high rates of high economic rates and good education, it's also a very stressful place to live in. Especially if you live in Tokyo or the big cities. If you have actually gone, then you will know how fast-paced they are. So there's a lot of stress. There's a lot of competition. So stress rates are higher. So that may be actually something that shows or maybe reflects back to the suicide rates. And number two, it's also back to how the Japanese population view suicide. From historically, it like here we religion here basically is very anti-suicide. I think many religions, most religions, Buddhists, well, they're not really sort of encouraging suicide. Definitely the Christianity is totally against suicide. Islam is totally against suicide. Hinduism to a certain extent sits on the fence. Okay, but generally I think all religions, but there the culture and everything, they to a certain extent, I wouldn't say they encourage suicide, but they are not totally against it. Like, for example, right from historically Japan, the harakiri, something called seppuku. Seppuku is taking your own life. Sometimes culturally it's also accepted as honorable to take your own life. in certain circumstances. So, I mean, these are all postulations, so I don't know how much it influences, you know.
Yeah, maybe like Japan, Korea also, these two countries, they
Right.
maybe this country is a pressure too much on the, something like that. Yeah, we do have also, but that's why everybody have their own story to tell, like, in fact, this kind of thing, right? Yeah.
Auntie Boleh, I think the other thing is stress, you know. I
Yeah.
think we must identify stress, and all of us are stressed, and we must do something to alleviate stress. And that's where, you know, I encourage everyone who is doing laughter yoga to continue doing it, even if everything is closed outside. Do it online, you know, because it alleviates stress. Stress will slowly build up to depression, depression to suicide.
Yeah, that's what Pauline was saying. We still have our laughter exercise. We have line dance and, by Zoom,
Online.
Yeah, all this, at least we cannot dance also, so there's still classes there, So
Yeah.
it's really true, like what Dr. Siva, you were just telling, we have to get ourselves, have more structure in life. We have to communicate. We build resilient, that means coping mechanism. Yeah, so these are the three things that we really need to actually make ourselves to do it, It just don't come naturally that we, because like what you say, watching TV at home. I have been watching TV at home all this while. Last time I don't watch so much, But what can I do? Evening, maybe I can go for a walk. And that's about all, Yeah, like sometimes online, Zoom, but you don't take out the whole day. So it's just that the structure of life, But now it's actually getting better in a way. But we still need to take care of our emotions. Sometimes, you see,
Yes.
like what you said, Dr. How would we, can we just, when the emotions come, right, at that moment, are we going to accept it? And what can we do at that moment, Okay, let's say, for example, now I'm feeling, it's no meaning, life is actually no meaning. I can't go out and, family members are not here, especially during Chinese New Year. You can feel that when everybody is celebrating, but they are not here with us, when this thing of feeling come at that moment, how are you going to deal, to at least for that moment, you take away the negative thoughts. How are we going to deal with it?
Yeah. So I think that's a good question, and maybe I think there's one with what Lee Jin has said. Maybe we'll leave it till the end, Lee Jin, and address that. Yeah. It is invariably whenever you're sitting down by yourself and thinking, a negative thought will come. The human brain. We keep telling students the human brain is actually predominantly negative. So if you're actually seeing a lot of positive people around you, it's not because they were born positive. No. They made themselves positive. They built positivity. So the human brain is always negative. For example, you sit by yourself, just think. You'll always think of the problems last time, the problems now, the problems later on. So what do you do with those problems? Because if you sit and think, more problems, it'll become more, and you get more negative, and then you drown in the well of negativity. Once you're in the well, to pull yourself up is very difficult, very difficult. So what we normally tell people is, when you have a negative thought, the first thing is try to analyze your thoughts. If you cannot do it yourself, then talk to someone else. Many a times you find that most thoughts that come to your mind do not make much sense. Like, for example, you sit at home, nobody calls you, nobody talks to you, then the thought comes, nobody loves me, nobody likes me, everybody hates me. This is a very common thought. But what is the proof? There is no proof sometimes. So what we tell people is, sit down and don't take your thoughts, or don't believe your thoughts 100%. Don't take it at face value. Ask yourself, what proof do I have that people don't like me? Has anyone told me? Has anyone scolded me? Has anyone commented? No. If you don't believe, then test it with someone. Talk to your good friend. Try to analyze the thought. Don't take it. But what we also tell people to do is do a lot of distraction. Distract yourself. The more you sit down and not do anything, the more negative thoughts will come. And that's what COVID has done to us. It's made us sit down and not do anything. So it's given time for the brain to start thinking by itself. So don't let that happen. Distract yourself. Don't even leave a minute of emptiness during your day structure. Keep yourself busy. Busy doesn't mean work. Busy can also be leisure. Listen to music, do your dancing, do your laughter yoga, call up, talk to friends. Like for example, if I don't have anything, I think, oh, what am I going to do? Okay, ring up, talk to a friend. Keep yourself occupied. The more occupied you are, the lesser the negative thoughts come. There's a saying in English, an idle mind is the devil's workshop. So don't keep your mind idle. Very important.
Yeah, thank you, Dr. Siva. Yeah, distract and keep occupy ourselves and to analyze the thoughts and all these things. That's the thing, sometimes we just really have to deal with this thing. We have to deal with this, right? Yeah, and then another question, okay, they were saying, right, you can see the views of COVID-19 vaccine. Some are still telling, some friend the other day just, hey, do you want to take the jab or not? I think I don't want to take first. I will wait and see. This kind of thing can or not. And then some of these things, even this also can cause
confusion.
In them, you wait, want to or not, what do you say about this? Yeah.
Okay. Before I start off, I think my disclosure here is, I'm a medical personnel, so I may be a bit biased in that sense, but at the end of things, the decision to take or not is yours, is totally yours. But my view on it, I think you've heard both sides of the story. A lot of people saying, "Wow, good." A lot of people saying, "Wow, bad." The truth is, we will never be safe. We will never be safe unless a huge population of the community is vaccinated. Because other than that, you will never be safe. The only way to keep yourself safe is to actually be vaccinated. But keep in mind, I think the ministry has also told you that there are some contraindication to vaccination. One of the highest contraindication is if your immunity is very low. So let's say if you've got low immunity due to maybe you're under chemotherapy or you're under some medication that brings down your immunity, then that is a contraindication. Number two, another strong contraindication is if you've got a very strong history of allergy, what we call as anaphylaxis, okay? This is very strong, severe allergy until you cannot breathe, until you need to be intubated, very strong. I'm not talking about allergy where you eat the food and then you start scratching, or you go outside, the dust, you start coughing. No, that is small allergy, minor one, okay. The major one, where some people until cannot breathe, cannot eat, all those things. Now that is also a very, very strong contraindication. The rest is okay. If I'm diabetic, if I'm hypertensive, can I take the vaccination? Yes, as long as the others are very, very well controlled. Yes, and I think someone who has got those comorbids, I think vaccination is a bit more important for them because they are also at high risk of more complications with COVID. Now the rest of you, I think you're okay. You're safe. I think age has most probably not got very little to do with it, So my thoughts are that the only way to keep ourselves safe is for all of us to actually get vaccinated,
Yeah. Then this Jennifer was asking because she's a dialysis patient, right? So she wants to know what about dialysis patients who have all she's still doing on the dialysis and all these things. Is she okay to take the vaccine or something like that?
Right. Jennifer, I most probably wouldn't be the right person to answer that because I don't know exactly the status of other tests and everything, Jennifer. So my strong advice would be go talk to your main treating doctor, who actually has got all your results and all those things. And I think he or she would be the best person to comment on it because they need to look at how your renal function and other things, all those things before you can give. Right.
Yeah, I have this my friend, Ramani, she just say, what is your opinion on social media's role causing negative thoughts in these times? Some people, they just like to say all these negative thoughts and what all these people they causing this kind of thing. We already so negative and then they add in all the pepper and salt or whatever things.
Yeah. Well, Ramni, maybe to start off with, I'd like to sort of say that, well, let's not generalize that, because I've seen some social media which actually do a lot of good, social media do a lot of good. But I agree with you 100%, Ramni, that social media plays a very important aspect, or very important role in dispersing message and information in the current generation. Well, if there are social media which is actually causing a lot of negative information or negative thoughts, then I think that's not right. They've got to improve things. But Ramni, you can't stop social media. It's there, and we keep telling our students also. I'm a teacher myself, so I keep telling students, so when you actually put something on social media and you read it, you must understand that it is one man's opinion. So if you're jumping to a conclusion, okay, if you're jumping to a conclusion based on one man's opinion, then I think you are wrong. Before we make an opinion, before we make a decision, we must listen to multiple sides of the story, because otherwise we will definitely go wrong if you just listen to one side of the story. So I think social media is good, but it also has to be taken with a spoonful of salt, So you've really got to assess the information that you get on social media by looking at what others have to say. So that's my distinct. Yeah, you can't control. Yeah.
Yeah, this is what Li Jin said. We can't control the social media. We are responsible with our own thoughts. Yeah.
Right. Very true. Very true.
This question keep coming in, Dr. Siva. They take the good opportunity. My daughter Jade will say, my daughter would like to ask Dr. Siva some tips on how she can advise or comfort her friend who is unhappy because she could not study her preferred course in university. Instead, have to accept the offered course, which is not her choice. Yeah.
Okay.
This kind of thing. Yeah. Yeah, this kind of thing is actually we actually, they have made their decision. What do you say about that? Yeah.
I'm an academic myself, and I keep telling people that education doesn't stop. I think that's a nice way to start off. I have a friend, a fellow associate professor in my place, and he is in his 70s, okay, and he is still doing his PhD now. At that age, education never stops. I understand many of us don't get our first preferred course in university, but it doesn't mean that after that we stop studying. No, whatever you learn is there for you. It's really there for you. I have students, I teach in a medical school. I have students who actually come in and say, doctor, I'm doing medicine because my parents asked me to do. I really don't want to do it. I want to do something else. So I said, at the end of your course, you have not wasted your time. You have learned something. The knowledge is there to keep. Your degree is there to keep, and nobody can take it away from you. Even if you don't work as a doctor, nobody can take away the DR from you. You're still DR. Then you can go and do something else. After that, education never stops. So just like I said, 70 years old and the man is still learning. So it's an inspiration. Yeah, it's lifelong. It's lifelong. So it's never a waste of time. Whatever course you're in, you are learning. You are actually learning, and that knowledge is there to keep and to help you. After that, he or she can actually go on and do whatever he or she wants.
Yes, thank you so much for Dr. Siva's sharing today. At least we learned a few things. Just to summarize, so that means you are actually giving us a lot of tips on all these things. Yeah, because Auntie, for working, because some of it Auntie's life is quite different because it's constrained so much during this time. But thank you very much, Dr. Siva, for sharing to us how the tips of how are we going to get our life goes on, the coping mechanism and all these things. Yes, thank you. So last, what would you like to add on just before we go off? Yeah, Dr. Siva.
Okay. Yeah. Maybe I would say, if life continues like this, okay, what I would like to maybe advise everyone listening is put back structure into your life. Okay, put back structure into your life. Start communicating with people, in whichever safe way you can. If you have lost your coping skills and mechanisms, look for new ones. Start building newer coping mechanisms to make yourself resilient. Identify stress. If you are stressed, talk to someone, go do something, alleviate it. So don't keep it to yourself because it's only going to get complicated. All right. So let's make the best out of things, hoping that things will actually change, but we'll make the best of things. And I'd also like to congratulate some of you who have actually registered for the vaccination program.
Yeah,
Okay?
I have. Yes, I have
Yeah.
too.
Congrats, and thank you. Yeah.
Yeah. Okay, thank you, Siva, for being with Auntie Bole. Yeah, it's
Right.
never too late that you are with me now. Is it because our copy is still continue? So if there's another chance that we Auntie Bole would like to invite you to maybe we talk on other topic, I hope we give you time, because I know for this you actually have. Actually, I invited you earlier, but you have something on. You're busy, right?
Oh,
But anyway, it's never too late. I'm so happy that you're with me
yes.
today. Yeah.
Yeah.
Thank you so much, Dr. Siva. So
All
it's
right.
time we say bye-bye to you. Thank you,
Okay.
Dr. Siva. Thank you.
Bye. Thanks, everyone. Thanks a lot for listening. Thanks, Auntie Boleh. Right.
Thank you. Yeah.
Bye.
Bye. Well, I see. It's so wonderful to have Dr. Siva with us today, So to remind us, okay, again, getting structure in life, this is what he say. And he emphasized on that. And so Auntie Paula still emphasize, communicate. Okay. Coping mechanism. This is what we really need to have. No doubt we know that it's never easy. But what I say, talk to friend, we analyze, we distract when we have this negative thoughts with us. We try to distract, we don't leave emptiness, in the mind, So keep occupying, do something different, So these are the things that, because we are all the while in the comfort zone of ourselves. So this is a time that we have to new coping skill. So, okay. So thank you, Dr. Siva, for being with. This is actually a wonderful sharing with us. Okay. So Auntie Boris still need your support. Please continue to share, whenever, because it will be every time, every week will be a very interesting things that we're going to meet, to talk about. See, it's a wonderful thing. Yeah, thank you all my friends for today's support. With me and all this. Yeah, thank you for the question that you asked. I'm also happy that Dr. Siva able to answer some of your questions as well. So we're looking forward to next week. Yeah, it's another interesting guest we're going to have. Okay. So remember, Auntie Bole loves to share. Please, you help me to share too. Okay? Thank you. 5, 4, 3, 2, 1. Thank you. Bye bye. Bye bye, everybody. Thank you.